Hello everyone, I'm Urologist Erdem Akkaya. Today we are going to talk about whether red light therapy increases testosterone. In 1939, a scientist named Abraham Myers published a paper. He said, "We shown a red light therapy device on the chest and testosterone levels increased by 120% in patients. But after red light therapy to the genital area, that is, to the scrotum area, the testosterone rate increased by 200%. So it increased about 3 times. You will say, how valid is a publication made in 1939? Why is it so popular 80 or 90 years later? A few YouTubers talked about it 2 or 3 years ago. Then these red light therapy devices started to sell in America in a great way. This may be a sales marketing technique. But it's a publication from 1939 that included a very limited number of patients. Considering that testosterone was discovered in 1935, this is a publication only 4 years later. In fact, the sun's rays provide vitality all over the world. It promotes photosynthesis in plants and is thought to stimulate the production of ATP in mitochondria in humans. Friends, red light therapy is actually widely used in medicine. We know that it is used especially in physical therapy in joints, pain in tissues, bedsores, in the treatment of wounds due to diabetes, in oral applications in the treatment of herpes, to improve hair loss or for serious skin blemishes in Western medicine. There are many spectrums of light from the sun. These are divided into ultraviolet visible light and infrared light. Ultraviolet light is especially important for vitamin D production. Many types of light are used in treatment. Low-level light therapy, red light therapy, photobiomodulation are used. We know that sunbathing has been recommended by doctors to patients for therapeutic purposes in the past. In Turkish, there is a very valid proverb, "The doctor enters the house where the sun does not enter." Interestingly, this red light therapy is very widely practiced in Russia. Special devices have been developed that are widely used for prostate inflammation, infertility, loss of sex drive and erectile dysfunction. Almost all of the clinical trials for this came out of Russia. When we look at studies conducted in the West, they have shown that when red light is applied to the testicles of animals, it destroys the testicles when applied in high doses, but when applied in low doses, it can stimulate the release of testosterone. But there is no clinical trial in Western research. There are many studies coming out of Russia in which both prostatitis is treated and infertility is treated. Sperm vitality, motility, and testosterone increase. When we sunbathe, the skin starts to produce a peptide called melanocortin. This peptide occurs after the skin is tanned, and we know that it increases sex drive and the quality of erections in men. Because PT-141, the drug currently approved by the FDA as the only drug that increases sex drive, is actually a modified form of melanocortin. So we know that tanning increases both sex drive, erection quality, and testosterone in humans. Because testosterone levels are even higher in the summer months. If you ask if we recommend it, we don't have a very serious experience at red lights. It is difficult to say whether we would harm or benefit the patient. We continue to follow the studies on this subject in Western medicine. Thank you for listening. Best regards.